Good morning, everybody. Thank you, Senator Whitehouse, for that introduction. I'd also like to thank Senator Portman and Senator Klobuchar and Senator Ayotte for hosting these forums and calling attention to this most significant issue. And I have to start by talking a little bit on a personal note, that it really doesn't escape me for someone with my own addictive disorder and in recovery, when someone with my own criminal record, the irony of talking at today's forum. And I think what I was given the privilege to do, we should afford every American who's affected by substance use disorders and diminishing barriers. So this is a truly important topic for us at ONDCP, for the White House in general, and particularly important for all of us in the room today. I want to thank Peter for being here, but I also want to acknowledge the two good doctors to my left here, Dr. Volkov and Dr. McClellan. I think all of you know the amount of knowledge that we have gained from their leadership on these issues, and we wouldn't be where we are today in terms of understanding addiction and trying to form public policy based on good science without their leadership in the field. And personally, these are two people who really help guide and shape my thinking around substance use disorders. So I really want to acknowledge their presence and their leadership today. I want to start with, many of you might have seen, there was an article in today's New York Times. I don't know if any of you have seen it, but I just thought that this is a very, very timely article that frames what we're talking about today. And so this is an effort with the New York City Health Department and the New York City Police Department in reframing policing approaches to substance use disorders. And I had the opportunity to meet with the Commissioner Bratton a month ago as he was formulating his plans. And so let me kind of read a paragraph. So if you haven't seen the article, I think it's really important. And so they're talking about the intersection of people with substance use disorders and mental health disorders with the criminal justice system. And so here's a quote from the article. Many of these inmates are so-called frequent flyers, constantly cycling in and out of Rikers Island, the city's main jail complex. The task force identified more than 400 people who had been jailed at least 18 times in the last 5 years, accounting for over 10,000 jail admissions during that period. 99%, they estimate, had a substance use problem. And it really underscores the magnitude of the number of people who are unfortunately incarcerated as a result of their substance use disorder, but how we really need to think about dealing with people as they're transitioning from our jail facilities and dealing with some of the collateral consequences. The President's National Drug Control Strategy establishes policies that connect people with treatment and recovery support for their substance use disorders and help them rejoin their communities and their families. Through our work with federal partners, state and local governments, non-governmental organizations, we help people rebuild their lives and find stability through education, employment, safe housing, and reunification with their families. However, after a conviction, these basic foundations of livelihood can be significantly more difficult to attain because of the federal, state, and local laws and regulations that place restrictions on individuals with criminal records. In many instances, low-level nonviolent offenses carry lengthy state or federal sentences. Yet even after serving these sentences, people face significant barriers and challenges in the form of federal or state-imposed collateral consequences that can affect them for years, limiting their access to employment, housing, and educational opportunities. These barriers are often unknown to the accused at the time of a plea hearing or trial. The American Bar Association, with the support of the Department of Justice's National Institute of Justice, created an online repository of collateral consequences of conviction from all 50 states, the federal government, and federal territories. As Senator Whitehouse said, they identified over 38,000 separate collateral consequences, approximately 75% of which are related to employment restrictions. In addition to these collateral consequences for individuals with criminal records, those with substance use disorders face additional burdens, as we all know. Some individuals have argued that placing additional burdens on individuals with criminal records helps deter drug use and associated drug-related crime. However, these do not take fully into account what science tells us about addiction. that it is a chronic brain disease that is characterized by compulsive seeking drug use despite harmful consequences. Research has linked drug use to crime. The most recent finding from a survey of arrestees conducted in 5 counties in the United States shows that about 2/3 of men tested were positive for at least one illegal drug at the time of their arrest. Most people convicted of federal state offenses have substance use disorders. The Bureau of Justice reports that 53% of state prisoners and 45% of federal prisoners meet the criteria for drug dependence or abuse. Moreover, among male probationers and parolees 18 to 49 years of age, 45% and 44% respectively were in need of treatment for a substance use disorder, according to the National Survey on Drug Use and Health. Besides self-referrals, the justice system is the leading referral point to treatment for substance use disorders. And unfortunately, it may be the first intervention point for people with substance use disorders to be connected to treatment services. Incarceration should not be our de facto treatment system. However, if we implement effective prevention services, intervene before an illness or condition worsens, and provides timely access to high-quality, affordable treatment, and remain engaged as we do for other chronic conditions, these services keep someone from becoming involved with the criminal justice system in the first place. For some individuals with substance use disorders who commit low-level nonviolent offenses, particularly as a first offense, pretrial diversion or other diversionary interventions may be more appropriate than incarceration. For those with a substance use disorder needing treatment, we must ensure there is good, high-quality, evidence-based treatment and recovery support in the community, coupled with appropriate supervision. Similarly, placing additional barriers to effective reentry into society in the form of collateral consequences such as limited or no access to subsidized housing and the inability to seek certain types of employment decrease the potential that these individuals will remain on the path to recovery. While efforts are underway to ameliorate some of the barriers to successful recovery, challenges remain. For example, a ban on eligibility for temporary assistance to needy families, or TANF, was enacted for people with prior drug convictions, but not for any other criminal offense. A majority of states have opted out of this ban or have modified to limit its effects. For some people, returning to the community and attempting to find work and housing and to reunite with their dependent children, TANF can provide a consistent source of income to support the families while they work on their recovery. In those states without a ban or modification, the lack of access to this assistance can be a significant burden when trying to get their lives back on track. No one can deny the power of education in changing one's life. Though the goal of corrections is rehabilitation, individuals can be denied this opportunity to better themselves because of a drug conviction. Applicants for federal student aid are ineligible for assistance for a period of time if, while receiving financial student aid, they committed or were convicted of any offense involving the possession or sale of illegal drugs. Questions pertaining to previous criminal justice involvement may deter an even eligible applicant from pursuing financial aid and ultimately higher education. Our office and the Department of Education clarified the regulations surrounding applications for federal aid, and the Department of Education changed the online free application for federal student aid, or FAFSA form. In the area of public housing, the harshest penalties apply to sex offenders and methamphetamine manufacturers, followed by people who use drugs and commit drug-related crimes. Individuals and their family members can be removed from and denied residency in public housing based on drug use. Local public housing authorities can exercise discretion in this regard to protect the safety and well-being of tenants and to preserve the rights of peaceful enjoyment of the property, a policy ONDCP supports. However, relapse can also be a part of recovery, and for those who do experience relapse, losing access to public housing may mean the difference between restabilization and backslide. To facilitate stabilization, the Department of Housing and Urban Development continues to encourage public housing authorities and multifamily housing owners to develop policies and procedures that allow formerly incarcerated individuals to rejoin their families. In addition, the department is training its regional and field office staff on its reentry efforts. The Office of National Drug Control Policy and the Department of Housing and Urban Development are also developing best practice series highlighting promising reentry approaches. The Burlington Housing Authority reentry program in Vermont shows great promise in working with individuals with substance use and mental health disorders on intensive supervision. It receives referrals from state corrections, Burlington Probation and Parole, and a local drug court, and works with local treatment and employment support centers. The program reports that since its inception in 2005, nearly 600 men and women successfully transitioned back into their community. Increasing access to employment is a top priority for this administration. Qualified individuals should be given the opportunity to apply and be considered for jobs for which their criminal records are not relevant or predictive. For those seeking employment, including more than 600,000 people released from prison every year, many barriers exist for applying for, interviewing for, and securing employment. In 2012, the Equal Employment Opportunity Commission, EEOC, released updated guidance on the use of criminal records in hiring practices. Following the adoption of this guidance, the EEOC conducted approximately 900 events reaching federal agencies and approximately 80,000 employers and workers. Just this June, the White House hosted an event honoring champions of change, individuals who help people with criminal records find steady employment. In addition to honoring these 12 individuals, the administration brought together business executives and government officials to discuss the challenges in providing job opportunities to those with a criminal record and in implementing hiring policies in accordance with EEOC guidelines while still balancing public safety concerns. This year, the Department of Justice is funding pilot sites to test innovative employment and workforce development strategies. Collateral consequences with individuals who pose little or no threat to public safety serve to further stigmatize the disease of addiction and those who suffer from it. Many of these actions are a result of the Federal Interagency Reentry Council. Federal action alone, however, cannot remedy the damaging effects of a criminal conviction. It takes state and local action as well. With its executive, legislative, and regulatory authority, states have immense power in reducing collateral consequences. Local authorities have a role to play as well. A concerted effort at the state and local level can change current laws, regulations, and practices that have a significant impact on eliminating lifelong penalties placed on those trying to rebuild their lives. It is incumbent upon all of us to work to rectify the consequences of substance use disorders, recognize addiction as a disease, and avoid collateral consequences like the ones I've described that are specific to those with substance use disorders, as they result in heavier burdens than formerly incarcerated individuals who do not have a substance use disorders. ONDCP's policies efforts are aimed at helping individuals with substance use disorders stop committing crimes by helping them find safety, stability, and recovery, and to help them contribute to their communities as full participants in their families and economies. Public safety is also a paramount concern, of course, but many of these consequences currently on the books do not improve public safety. They may, in fact, keep people from becoming productive members of society after they have served their time. Rethinking drug policy is not an easy task. Moving forward, I hope all of you will continue to be leaders in working to eliminate the barriers to successful recovery and support people re-entering their communities from a period of incarceration. Science and data alone, however, don't change public policy. Sorry, guys. Fundamentally, people change public policy. As a gay man in recovery, I can't help but reflect on yesterday was World AIDS Day. And I think about the changes that people affected with HIV and their families and community members changed the perception of the illness and fundamentally changed public policy. So those of us in recovery, those of us affected by recovery, also have an additional role to play in coming out about our own addiction, just as Senator Klobuchar talked about her father in recovery. That we need science and data to guide our policy. We need good leaders at the federal, state, and local level. And we also need champions for those of us who are in recovery to talk publicly about our illness and to change the fundamental perception and public policy about people with addiction. You know, there's a phrase that I often heard, that it's hard to hate up close. And by virtue of talking about our recovery, by coming out about our recovery, we fundamentally can change the way people view people with addictive disorders and continue to move on changing public policy. Once again, I'd really like to thank Senators Whitehouse, Portman, and Ayotte and Klobuchar for keeping the spotlight on such a critical issue for justice-involved populations. I look forward to continuing this conversation and with working with you to make our country safer, healthier, and more just. Thank you very much.